So I'll talk a little bit about one particular use case for AI in healthcare around diagnostics and imaging. AI has been used in healthcare to improve speed, the accuracy, and workflow efficiency for quite some time. But this is one of the areas that I've worked in quite a lot, where we're using visual analysis from AI on scans of different kinds to detect all kinds of diagnoses, including cancers, for example. And its capability in trials demonstrates that it can outstrip clinicians to quite a degree in the diagnosis, and it is now being adopted in healthcare services. But AI is also used in other areas, not just the diagnostics, to optimize resources and patient flows in clinical pathways, for example. So in this use case, what are the benefits? Well, better diagnosis, so more accurately, so we get right more often. So patients are diagnosed more accurately, diagnosed quicker, because this is a real-time uh, system, so that you don't have to delay to get the right diagnosis, and then of course, you get more effective treatment because the accuracy of the diagnosis is higher, so patient outcomes are better. And it also enables higher throughput in hospitals and higher discharge rates as, again, the right treatment for the right diagnosis. Everything becomes a lot more streamlined. And it's becoming a real world normal capability now. Those of us that have worked in this area for a long time would be glad to be seeing that. And they can, for example, reduce hospital stays. An Australian case study by 6.5%, which equates to tens of millions for a large hospital service. Um, and 74% of healthcare executives report seeing an ROI from at least one AI use case. So it's becoming normalized. What are the costs? Well, it's very specific down to the use case. So, what's the clinical pathway? What's the diagnosis pathway? What systems does it need to be integrated in? Does the business process need to change? Probably. So the investment can be quite high, and the term of that investment needs to be taken over a multi-year window as well as the impacts on improving patient outcomes and hospital outcomes take years to demonstrate, really. Um, but the ROI um, typically happens across multiple years due to the complexity of patient care and so on, and to demonstrate that. But one example here demonstrates a 451% return over a 5-year period. So it's becoming a lot more normal, um, and we're going to see a lot more of it. And hopefully, we'll see AI improving our clinical outcomes substantially. That's AI for diagnostics and imaging in healthcare.